This is Focus with Jack Caudill.
Good evening, I'm Jack Caudill. Welcome to this month's edition of Focus. This month we're talking about adoption. November was National Adoption Month. Three guests with us to talk about that. Dr. Brian A. Wilson, he is a psychiatrist with the Children's Home Society of South Dakota. Kelli Whartman is with Catholic Social Services. She is the department head of Trinity Pregnancy Adoption, and also a licensed social worker. And Paul Enos, he and his wife Dottie are the parents of 10 adoptive children. The National Council for Adoption says there were 363 domestic adoptions in South Dakota in 2020. They also said there were 209 children adopted from foster care in the state also back in 2020. Dr. Wilson, we're going to start with you. First of all, thanks for coming up. How big is the need for adoptive parents, and where are the kids coming from?
The need is huge. The children come from all over. South Dakota has a huge need. There's needs in other states as well.
And where are the kids coming from? What kind of backgrounds are we finding there?
They come from a variety of homes. A lot of the children that we deal with and that I deal with are coming out of situations where they've been in abusive or neglectful homes and that sort of thing, and they've been removed. They've been taken into foster care to keep them safe, and then at that point they may have special needs, medical needs or other things in terms of mental health needs, and so then it's a matter of trying to find placement for those children.
Are there more kids needing placements than there are people looking to fill those roles?
By far. I welcome anyone to look into that if they have any interest in it.
Kelli Whartman with Catholic Social Services and Trinity Pregnancy and Adoption. You said you mainly deal with infant adoptions. How big is the need there?
Actually, there are 2 million couples in the United States that are waiting for an infant placement, so it's not as big as the need of foster care adoption, but we still want to be there as a resource for those expectant families that are looking to place their child.
Now, are these mainly parents who can't have kids of their own, parents who choose to have kids of their own, children that feel the need to help out another child? Where are they coming from?
In our program, we focus on couples that are struggling with some infertility. That doesn't mean they don't already have children. They might be dealing with secondary infertility, or it might be a second marriage. So it is a variety, but we do place preference with families that are dealing with infertility.
Now, Paul Enos is coming at this from the other side of the equation. Obviously, you don't start out adopting 10 kids. How did this journey start for you and your wife?
Yeah, so there was a need with a relative that she was going to have twins, and my wife said, don't you think we should do something? And I said, no. I think we already have kids of our own, and we're busy, and we have a full life. But it just became clear as we went on that that was the step we should take, and from there it just got bigger from the first kids we adopted.
Any thoughts when all of this started that you were going to end up with 10 kids? You say you have 10 now between the ages of 4 and 18.
Correct. Yeah, zero chance that we thought. I even remember thinking that when we were going to adopt our relatives' twins, I was thinking, I don't know how I could love them like my own. And obviously, that's history. Mm-hmm. And we never expected to adopt more than 2, but all the kids we feel like they blessed us more than we blessed them. So it's really been amazing.
What was it about this? What was it about all of this that made you continue and bring more children into the family?
Well, it's funny because my wife just got a call today for emergency placement, and we're kind of full now with 10, and so we really haven't done any more foster care since we've final adopted 10, and we get a call a lot, like need to help, and my wife said to herself, if this is a baby, I'm going to say yes today for this emergency placement. So I think it was so obvious that this is what we were supposed to do. It was so obvious that this was something that really we were supposed to do, and that's what we've been doing.
Now obviously, he's talking about the rewards of doing this. As you see it, what are the rewards that you see from adoptive parents that they're getting out of this?
There are so many. So often I see parents who just, to have that child in their home and to have that sense of family, the rewards, they tell me so often that they experience things that they never thought they would have. And it's so fun to watch because of that sense of belonging that the children get, but also that sense of family that the adoptive parents get as well.
Now you're talking about the reward the parents are getting. How about for the child? Now you've got, when you're talking about kids and foster kids, what does that mean to them to have a permanent place instead of, a lot of these kids are getting shuffled from place to place to place?
They are, and as you can imagine, that takes a toll on a child oftentimes. So many times people feel that they can't get into adoptive care because they don't know that they could provide the perfect home. And the truth is there are no perfect homes, but it's so important because they can offer that. For the child, this is what helps them to succeed. The research shows that these children not only thrive when they're in that adoptive home environment, but they thrive after that as well as they go into adulthood, and they do so much better. There is that social connection, there are the financial aspects, there are the social support networks that are created by that family, and it often goes both ways. The children get that from the parents, and the parents get that from the child.
Kelli, you're talking about people adopting infants. What is the reward from them? What is the reward that those parents are seeing through all of this process?
I think oftentimes an unexpected reward is that relationship with the birth parents. So prior to like the 80s, a lot of adoptions were closed, and now it's much more common for them to be open. And sometimes parents are scared of that, but with some education, they learn what a blessing open adoption is and welcoming the birth parents into their family as an extended family member.
So what are the different options there? You're talking about closed adoption where there's no contact between the birth parents and the adoptive parents, and open. What are the different options that are there?
Yeah, an open adoption just means there's an open relationship. They are doing visits, they're opening each other into each other's lives. There's also closed adoption. Those happen. Sometimes the parents want me to pick the family. I actually had a case a couple years ago where the mom wanted an entirely closed adoption. She wanted me to choose the family, and then she changed her mind at the hospital and wanted an open adoption. So it was really cool for her to meet the family and just blossom that relationship. There's also a semi-open adoption, which we do most often, where they just share pictures and updates once a year or a few times a year, whatever they choose. So it's kind of up to the birth parents.
Paul, from what you've seen on those different things, what works for you guys?
So for us, I think we've tried to keep a relationship with the parents that we can. Lots of times it wasn't, the parents weren't around. There are all sorts of different situations, but really one of the little boys we have right now, we've visited the mom in prison multiple times. We've went to Pier with the little boy, and so we're all about helping not only the child, but helping the parent as well find a way to move forward and have a good life. Make adjustments, whatever that might look like.
All right, we got to take a break. We'll continue our look at adoption. Talking about the rewards, we'll take a look at some of the challenges that come along with that when we continue with this month's edition of Focus. I'm Jack Caudill. Welcome back to this month's edition of Focus, talking about adoption. Paul Enos, he and his wife Dottie are the parents of 10 adopted children. Paul, we talked about the rewards of all this, but there has to be some challenges along the way. You get everything settled in, and then there's another child, and you get settled in. What are some of the challenges of blending a family like that?
It seems funny to maybe to outsider, but it's the kids that want more. You'd think at some point, like maybe if you adopted 2 or 3, they'd go, okay, that's enough. We have a little family, don't bring any more in. But our daughter that we adopted, the first one at 18 years ago, when we had a little boy that actually I said no to, she said, why wouldn't we? Why wouldn't you take him? And so I think it's in the heart of a child that they feel, and so that part, really has been easy. I think there, of course, are challenges, but I just, obviously there's behavioral things and all those, different things, people that struggle with school and they can't get through school because of some of their behind and all those pieces. But the rewards are so much greater than the challenges, really, honestly.
Do the kids adapt quicker than you think kids would adapt?
I think they do. They just all the kids, again, not that there aren't sibling issues with all of them, just like normal family, but there was no like, well, you're an outsider when you came in. It feels like right away, all the kids welcome them in. And so really, besides the child growing, we see child changing and making progress and becoming a better human being. Besides those things that just take time, really the connection is quite amazing right away.
Dr. Brian Wilson is a psychiatrist with the Children's Home Society of South Dakota. You work with families and work with kids. What are some of the challenges that come along with putting a child into a new family?
Yeah, a lot of times the children have been through various difficult situations, abuse, neglect, and those sorts of things, have been maybe removed from that home environment. So they have a lot of fear about what is it that they're going to see when they get into this new home, and what is that going to be like, and how long will I be there? Will I be removed again? And that often leads to a lot of anxiety as they're getting ready to go into this placement. And a lot of times the parents will have concerns about what is it that we're facing, what are we looking at? What do we expect? What are we going to be dealing with? And so trying to get those things together, because they do have sometimes they have those experiences, those traumas, and letting the families know that they're not going through this alone and that we're there to support them and we're there to offer help, to help make that transition go smoothly, and understand that there are going to be some bumps in the road, there are going to be some challenges, but the rewards far outweigh those challenges.
So you talk about being there to help. What do you guys do? What do you do to help families like that? Help them through some of the roadblocks that may come along the way?
We are in the process right now of setting up a new outpatient clinic here in Rapid City, where we'll offer child and adolescent psychiatry services as well as therapy services, and we're looking to expand those services even more, because it's not just about getting those children into the home, it's about helping to be there and helping them to be successful, to give them the support that they need.
Kelli Whartman is a licensed social worker. She is with Catholic Social Services and the department head of Trinity Pregnancy and Adoption. What kind of challenges are there for parents adopting an infant, which is what you guys deal with for the most part?
Red tape is usually the biggest challenge for parents, and also a lot of fears related to stigmas and myths about adoption. They have to do a lot of education, which I think they actually end up enjoying a lot when they're in the home study process and getting licensed. So that, and just waiting for a placement, it can be really challenging, and they have to be patient, and it's just so important for our community to come together for adoption and share stories about these families that are wanting to adopt children, so that expectant parents that might be in a crisis situation can see what wonderful families we have that are ready to take on a new member of the family.
Now, you mentioned some of the myths about adoption. What are some of those?
Oh goodness, the other day I was on a Facebook group for moms, and someone anonymously posted that they were pregnant with like their 4th child and they didn't know what to do. And there are still so many people saying, oh, there's so many children out there that need adopted. No one's going to adopt your baby. And the comments were shut off before I could even comment on it. But that's just not true, because there's so many families that are out there wanting to adopt an infant. And most moms are in that situation. They're not teenage moms typically. They're moms that have a few children that they just can't afford, unfortunately, and they're in a desperate situation. So there's just the expectant mom is not what you always think they will be.
Now, Paul, are there myths about adoption that you think people might have about your family and things that they don't understand?
Well, yeah, I'm sure, there's lots of stories about our family that, that I don't know about, but I think the myths is that if everyone knew, it's not for everyone, but for those families that should be adopting and should be fostering, that are haven't taken that step, I think if they knew how wonderful it was, how great it was for them and for their family, I think maybe that's a myth, that we wouldn't have this desperate need, that there's so many kids that need to be adopted or fostered, and so I think that could be a myth that we should get rid of.
Kelli, who can adopt in South Dakota?
There are lots of requirements. You have to be at least 21 and a certain age over the child you're adopting. But our agency takes on married couples that are ready to do it. We do have a wait list right now because things are kind of slow, but as we get placements, we can take on more families. But
I'm assuming there's background checks, all of that kind of stuff before you can adopt a child?
Lots of background checks, interviews, references, home inspection. It can look like an intimidating process, but we have a system to get it done.
All right, we have to take another break. We'll continue our look at adoption when we continue with this month's edition of Focus. I'm Jack Caudill. Welcome back to this month's edition of Focus, talking about adoption. As of June 30th, the South Dakota Department of Social Services said there were 1,710 children in foster care here in South Dakota. In the last fiscal year, they say 233 foster children were adopted. The average time from placement to adoption was 34.2 months. Dr. Brian Wilson is a psychiatrist with the Children's Home Society of South Dakota. You deal with a lot of foster issues and foster children. How big is the need for foster parents? We talked about adoption. Is there a need for foster parents as well?
There's a huge need. There are so many children that are looking for placements. The state, when children get removed from the home, there's a need to get them into a safe location. Or if they've gone into a residential program, to get out of that residential program and go into a foster care program so that they can await that adoption process.
Now, the Children's Home Society talks about therapeutic foster care. What is that?
Therapeutic programs or therapeutic foster homes are part of that, setting up, as we talked earlier, about getting them into an environment where they have the support system in place so that they can have those therapy services. They can work with some of the behavioral issues that they may be seeing in the home to address those things, those challenges that can come up, so that the families have that support.
Now, you guys also now working with Wendy's Wonderful Kids. What's that program?
We are. Wendy's Wonderful Kids is a great program that was created by the founder of Wendy's, the restaurant. He was himself adopted. Dave Thomas created the Foundation for Adoption. And that is often working with children that may have special medical needs, special emotional needs. Some of those things may be older children that are maybe a little bit more difficult to place. And so we focus a lot on getting those children into homes, helping get those families connected.
Kelli Whartman is with Catholic Social Services. She's the department head at Trinity Pregnancy and Adoption. What are the services that you guys have down there?
Besides doing adoption and home studies, we also do some community involvement. I'm part of the Why Not You Coalition, which is a recruitment organization of all the different foster care and adoption agencies in the Black Hills area. We work with South Dakota Kids Belong to recruit foster and adoptive parents. We promote WRAP services, which is words of encouragement, respite, action, and prayer, so that the community can get involved in the adoption and foster care process through their church, through their ministry, to pray for families, bring them meals, mow their lawn, really help in any way, shape, or form. And then we also do parenting education. So I'm trained in common sense parenting, and then I also do a trauma-informed parenting class called intentional parenting. And then we offer pregnancy services, so case management for people that are just looking for any extra support that they can. while they're pregnant.
Now, you guys mainly do infant adoptions. Are there challenges to adopting older kids, special needs kids, those kind of things?
There's definitely challenges, and I think that's because people are afraid to adopt older children. They think that infant adoption would be easier, and it's not always easier, but the need is there for older children. And I hear so many times that people don't want to adopt or foster because they're afraid of attaching to the child. And that's such a myth, because adoption or attachment is such a gift. So any way you can attach to a child, no matter how long you have them, is a gift to that child, and it's a gift to that parent.
Paul Enos, he and his wife Dottie are the parents of 10 adopted children. What's the difference in adopting an infant, and what was the oldest child that you guys have adopted?
12 years old was the oldest. We had a sibling of 12, 10, and 8. 3 little boys. They came together. They were the oldest. So the older ones, they talk back. The babies don't. But really completely challenges on both ends. And this. The one boy, he's going to be a senior, and had a difficult life, but he's blooming, so beautiful. He has a smile that would turn any lights off. Just amazing. And so, again, different challenges, but amazing stories all the way through.
It seems like this has done as much, if not more, for you than it has for these kids.
That's what I said at the start. It really is an amazing journey, and we feel blessed by God for allowing us to do it.
Dr. Wilson, if somebody is interested in adoption, what do they do? How do you start this whole process?
Reach out. First of all, just because you ask questions, just because you question whether this is an option, doesn't mean you have to commit yourself to it. But we have people, there are people in other organizations as well that are more than willing to discuss it with you and look at that. They can oftentimes help reassure people. They can help to relieve some of those questions and those concerns and those fears that they may have about becoming an adoptive parent. And so if they will just reach out, they can go through that process and learn more about it. And oftentimes, as they learn more, they're more comfortable with the process, and they can find that the rewards that they can get from that can just be amazing.
Kelli, how do they get started? If somebody wants to take, or at least take a look at this journey, what do they do?
They can contact any of our agencies or the state with the Why Not You Coalition, or go to South Dakota Kids Belong and see those stories of some of those more difficult to place children. And even if you just want to start small, you want to be a respite parent, so just emergency care, that's a great place to start.
Paul, I got about 30 seconds. Any last advice for somebody that's wavering and thinking maybe this is for me?
Yeah, I think if you take that step, you'd be glad you did. I think it'd be something that you'd never regret, that you would look back and say, boy, that was one of the best decisions I made in my life.
All right. Hey, I want to thank you guys for all coming up. Paul Enos, Kelli Whartman, Dr. Brian Wilson. I want to thank you guys for joining us for this month's edition of Focus. Hope to see you again the first Sunday night of next month. Good night.